Michael Farnsworth and me from the Program Management Office. Online, I'm seeing Jeff Jeffries, Kathy Slimp, and Jennifer Lumpkin. Is anyone else on the line? Sounds like someone just joined.
Good afternoon. This is Mary Linehouse at CDC.
Hi, Mary. How are you doing today?
I'm good. How are y'all?
Great, thanks. All right, we were just about to get started because today's agenda, as you're going to see, is jam-packed. As Jerry Reed used to sing, we got a long way to go and a short time to get there. So I wanted to just kind of talk about 4 big buckets of items that we're going to discuss. And rather than saving the discussion for the end, I think we'll just try to have some conversation as we touch on each of these. Want to talk a little bit about index use to date and promotion, especially an event that's coming up in the next month and a half or so. That we just got the one-page finalized on it, the one-pager finalized on it today from the RWJF communication team in McCabe. Unfortunately, Jen Chu, who normally joins us from McCabe Message Partners, is out today, so I'll be sharing with you the overview of that event, and any feedback you have on it we will certainly transmit back to McCabe. They should be rejoining us for next month's call. I want to talk a little bit about the draft production timeline. It was developed and discussed with our methodology and model work group. I think I mentioned last month that those formerly 2 work groups, analytic methodology and model design, have merged as of July. And they and the PMO have discussed a preliminary draft production timeline. Some issues were raised there that were then discussed at a NAC meeting, a National Advisory Committee meeting that we had just last week in Washington. And I'll be happy to share with you what we've heard from that. It sounded like we just had someone else join.
This is John Osborne.
Hi, John. How are you doing?
I am well, thank you. How are y'all?
Great, thanks. So glad to have you on the call.
My pleasure.
Just talking through the agenda right now. So we'll talk a little bit about that production timeline. We're eager to get your feedback. As I said, we had some feedback from the model design work group, and then the NAC had some more discussion on it last week. So. But I'm sure that you guys will have some input as well on that. We also have the production priorities. I want to give you a sense of some of the big picture, big ticket items that are being discussed for index development this year. We don't have anything like what happened last year during the transition teed up in terms of the number or magnitude of changes, but there are some enhancements to the index that are being considered, and I want to make sure that everyone is up to speed on those and sharing any thoughts you have as we move forward with that. Then something that we're really going to be focusing on over the next year is thinking about the kinds of tools and resources and user guides and whatever is going to make the index most useful to people, because we don't just want to put out a set of numbers, but we want folks to be able to use those numbers in practice. So we're trying to think through how we can best do that, how we can best support you. So right now in these early stages, it's a critical time for identifying what kinds of toolkits we might want to look at as we're thinking of potential directions forward. So I know you guys are going to have a lot to say about that, and I know you're going to be incredibly important in that tool identification and development process over the next year or longer. And then any other business, we have some carryover items from last month, and then other items. Any questions about the agenda before we get rolling? All right, I'm going to fly through a couple of slides really fast. If you need more information, just let us know. At the end of July, or early in July, McCabe Message Partners shared with the foundation some information about promotional activities to date, particularly with the media and the website. In terms of media promotion, you can see here that there was coverage in more than 30 states. You can see some of the outlets there. Twitter traffic spiked the week of the index launch. So this is just a quick thumbnail to give you an idea of the kinds of things that were touched on and where. In terms of the website, I asked for some additional updated numbers, and we have here, you can see traffic since April 26th, which was our launch date. The duration of a visit right now is about 2.5 minutes. We're hoping to get some more in-depth, a deeper dive into that traffic to see how people are navigating the site, we have here some information where they're entering, but what we'd really like to know is where are they exiting, where are we losing folks. We also have a lengthy list of some of the referrals that are sending people to the website. Some of the state public health associations, state health associations have been really helpful in directing traffic to the site. So that's just a quick look at that. Something I wanted to share with this group in particular, since we have discussed what we've learned from the use, usability, and usefulness survey several times, is this picture of how that traffic, that website traffic has gone over time. As we would have had indicated in that survey, folks are visiting it, folks indicated that they were visiting it early and then not really coming back to it. We do have here a graph showing there has been a drop-off since the launch week, which is to be expected to some extent. I think one promising piece of this is that a lot of these are new views. In every case, in every month, over half of the traffic has been new users. So that's a sign of hope, but I want to get those returning numbers up as well. I think that's something we need to be thinking about, is how to keep people engaged across the year. There are a number of ways that the communications team with RWJF are working on. We're going to talk about some of those. But the first and most important one for this group to be thinking about right now is what's coming up. It was initially planned for September, but as of this morning, it looks like it will be moved to October. The McCabe Message Partners and RWJF have been working on plans for roughly an hour-long live virtual event on index use. You can see here a thumbnail of this event. It'll be like a Google Hangout. I don't think it's going to be Google Hangout. I think they have another platform they use, but it's very similar. And as many of you know, RWJF has been using those platforms a lot over the last couple of years around its culture of health initiatives and to get some conversations going. The primary audiences are state and local public health directors and staff, state and local preparedness officials, national public health associations, national and state hospital associations, healthcare associations, and Capitol Hill staff. One of the reasons we're discussing this now is because we had initially talked about having an in-person preparedness month event on the Hill. In the past, the index has done that with the launch or with the release. This year it was decided to wait and do something a little closer to Preparedness Month. And as we've been looking at some of the information about use, the decision was made that we really need to promote use among a broader array of folks than those who would necessarily be able to attend in person an event on the Hill. So we're going to be going forward with this use event. We did discuss it with our National Advisory Committee on Thursday of last week, and schedules are being worked out and crunched right now to try to identify the date. The meeting itself, the virtual event, will have a panelist comprising folks from our National Advisory Committee and from both federal public health preparedness and state public health, folks from the Robert Wood Johnson Foundation, and folks from the Program Management Office, talking about really five things. Using the index as a yardstick to measure preparedness, kind of the vision on which the index was founded and what we hope to see folks thinking about. An overview of index findings, discussion of the index as a tool for collaboration, which is obviously a central core use. Index methodology and navigating the measures. We're hoping not to get too in the weeds. In fact, the plan right now is in advance with the invitation and the promotional materials that will go out about this event will be a brief video about navigating the measures and the methodology, but this will just be a quick sort of high-level look at that. And then talking a little about the future of the index, what's coming down the pike, and again, we'll talk a little bit about some of those priorities in a few minutes. But now that I've thumbnail captures the nuts and bolts of this meeting. So I wanted to put out to this group, particularly since it is butting up against Preparedness Month, and it's a shame it looks like it's going to bleed over just past Preparedness Month because of scheduling. But what are some opportunities? You know, our NAC mentioned that there are a lot of great Preparedness Month activities that we should be able to tap into to make sure that we're linking up with a promotion of this event, and then perhaps we can also be using some of our platforms, the Twitter feed and other platforms, to promote other Preparedness Month activities. So I was hoping that we could get a little bit of discussion going here about how best we can promote an event like this, because you can't assume if you build it they will come, and we want to make sure that if we're having this event and we have our National Advisory Committee and there to answer questions and to talk and to share, that we do have folks there who need to be the folks who need to be there. So I'm going to hush now. I feel like I've talked a long time, and ask you guys to talk a little bit about what we need to be tapping into to promote this event.
Definitely share our various letters. The other thing I wanted to bring up, do you know what the date of the event will be?
I do not yet. There are some scheduling. The McCabe folks have been working with the admin assistants of the folks who are tapped for the panel to try to schedule. As you can imagine, with between Louisiana and Zika right now, people's schedules, I know you know this, Jennifer, better than anyone, are kind of slammed, so they're trying to identify what's going to work best, and I'll get you that date as soon as it's been given to me.
So if it's so we if the event is can also that goes out, have it if we can collect that information August.
Excellent, thank you. My guess is, based on where they are with scheduling, that we probably won't make the August newsletter. But I will, as soon as I have dates, I will work with you to make sure that we hit all those points, and I can be on the call, or we can have someone else on the call in October. Since October the 4th is so early, I'm betting it'll probably be a little after that. But again, that's just my best guess right now. I'm guessing probably mid-month based on I think where we are.
The 20th.
I'm sorry, I missed part of it. Something on the 27th? Yes.
October or September?
October. Mm-hmm.
Yeah, and right now we don't offer.
I understand completely. We've planned many a meeting in this office, and once you get a couple of months out, it's really a challenge. But absolutely, excellent.
Other things. Those are the things.
Thank you so much, Jennifer. That's really helpful.
Sure, no
Do other folks have thoughts of channels or venues that we might want to make sure is on McCabe's radar as we're promoting this event?
I'm assuming with Dr. Lurie and with Dr. Red on your NAC that they would jump in with channels as possibilities. Dr. Red's preparedness posting each month and upcoming events and that kind of thing.
Exactly.
Yeah, and Asper could get out messages as well.
And it's very likely that one or both of them will actually be on the panel. Oh, we're having some feedback somewhere, but I think it's very likely that one or both of them will be on that panel. I think right now it's just a matter of scheduling. Are there ideas about, we're talking a lot right now about public health audiences and public health folks. Are there ideas about other ways to reach, for example, healthcare, emergency management, maybe the VOAD, COAD sorts of sectors so that we can get a broad base here? I think obviously, in terms of the legislatures and such, I think we have some great connections with CSG and NCSL, obviously. But in terms of some of these other groups that we aren't always as successful in connecting with.
Do you have a link to the VOAD COAD group? Do you have a contact there? 'Cause I think that would be a neat group to start reaching out to more, and I'm sure they have newsletters and updates and those kinds of things that they send out as well.
Yeah, Glenn actually was on a panel with them, and I can't remember her name, but I have it written down with the InvoEd group, and that's someone we're also hoping to invite to join this work group. We're always getting ideas about who else we can bring on board with the work group, and as you guys have thoughts and you have connections that you feel should be involved, please do let us know about those. But absolutely, we want to make sure that those folks who are actually on the ground and spending their time volunteering to assist with these efforts are definitely important to keep in the loop on all of this.
The other thought is just to utilize our work groups. You got representation from a variety of places. If each of us were to send it out to connections that we have in our own organizations or throughout our own networks, that would promote it as well.
Excellent. Thank you, Kathy.
Amy, this is Jeff, or Anna, this is Jeff. I'd also suggest to the ASTRO senior deputies for each of the jurisdictions. In years gone by, I know a lot of stuff has gone out through the shows, but I think as busy as they are with a multitude of activities, opioid overdose, childhood obesity, Zika, and other things, may be a conduit to the senior deputies, and then senior deputies coordinate with their public information office, the director of public health preparedness, and those folks, as well as even with EPIs and others as seen in the index. And from that, I'd also suggest maybe going through the CSTE, having them review and then get the word out through their EPI channels. That'll also help the DPHP community get the word out. NIFIC is also another good resource. And the only problem I have with that is if you send something independently to NIFIC, then the senior deputies or the shows are not aware that there's going to be something coming out that may implicate their state. That could very well be problematic if the score is low and the senior deputy or the show doesn't have an opportunity to look at the index, discuss the index with leadership and or the director of public preparedness before it's actually out on the wire.
Excellent. Thank you.
As far as emergency management, I would suggest NEMA or IAM, Institute of International Association of Emergency Managers, either NEMA and or IAEM would be a good resource. If you're reaching out to emergency management, of course, the healthcare community would be through ASPR at HHS, the program folks over there.
Yeah, the IAM, this is Osborne, has an active healthcare, group that has an active email listserv. I think that would be relatively easy to tap into. Do you have a connection anywhere with the AHA, the Hospital Association, or similar?
We have some because we use some of their data, but that's more of a data in than an info out group. So if you have any recommendations of someone we should particularly contact, that would be helpful. We do work with, everything's so siloed. You never know when you're talking to a person in this section if it's going to make it to the other.
Yeah. So Raj Schulman she's one of their government relations leads, and she's been very active in the preparedness space. I can get you her contact information if you don't have it.
Fabulous.
And I would think then, following on to Jeff's comment, the critical infrastructure, the healthcare public health sector coordinating council within the critical infrastructure program also is pretty active about disseminating these sorts of information. And I've got some connections with their branch chief as well as with their public, the private sector folks. So that may be another group. I mean, it's kind of a motley crew, but you'll hit private sector pretty heavily through that. You'll get the state hospital associations through AHA. And I would agree, if the goal is to get this into public health and public official, or opinion maker sorts of things, you're going to want to hit the hospital associations. And they're going to want to know if there's going to be a splash, if they've not seen it already, if the healthcare subsector, like in Minnesota, we do very well, but our healthcare subsector is low relative to the rest. And I think you want to kind of at least give people talking points, if not kind of the direction on here's what that means.
Okay. Excellent.
Anna, are you all taping it that people could, I could see people using an excerpt from it, if it's an hour-long kind of condensed thing, using an excerpt from it as part of a healthcare coalition meeting or another partner meeting. Will it be available afterwards for download or able to be segmented into pieces?
Absolutely. One of the opportunities that really led to the decision to do this as a virtual platform was the ability to really archive it meaningfully on the website so that folks can reach back to it. Because as I mentioned earlier, one of the things that we really want to focus on this year is building tools and resources to help people navigate the index, and this is an important step in moving in that direction. Absolutely. All right. Well, hi, Melissa. I see Melissa Marcus has joined. Has anyone else joined as well? I've heard a few beeps.
Mary McQueen from Michigan.
Hi, Mary. How are you doing?
Good. Sorry for the delay.
No worries at all. So we've got Melissa and we've got Mary. Anyone else on the line? All right. Well, this has been a really great discussion, and I think we could continue talking about this all day, and I really want to encourage folks to send me follow-up emails as other ideas occur to you about this so that we can build as robust a set of background information for McCabe and the RWJF folks in terms of promoting this event as possible. Thank you all so much. But I do know we have a lot to get through, so I'm going to just jump ahead to the draft production timeline. And I think I have an idea. Since we've talked about this with a work group and a NAC, I've got an idea of a couple of things we might hear, but I want to hear them. So we've got this draft production timeline that was first discussed at the in-person methodology and models work group that looks a little like this. We are already in the midst of data collection for the 2017 index. This is ongoing. We have this virtual event on 2016 index use, which is, as I mentioned, it looks like it's going to get bumped into October. We're also going to be doing, last year we did a call for new measures in the spring. This year we're going to start the call for new measures in September and run it through October the 18th. So we'll be reaching out to you all as well to help us disseminate that information through your networks to make sure that anyone who has ideas for data sources or measurement gaps can participate in that. Then, just as last year, we're going to have a public comment period on proposed changes to the 2017 index. Again, this will not be anything like the 100-plus page detailed methodological document of last year. We're not anticipating making those kinds of changes this year or that scale. January, we're looking into final index calculations and the meeting of the National Advisory Committee to discuss what that's looking like and if there are any changes we need to make mid-course. So that will be in January. Then the preliminary results, with the preliminary results going to state public health officials and others for vetting in February, early February, following that NAC meeting. And then index release late March with index promotion, much as this year, carrying on through spring and into the summer. And hopefully we'll be able to get a hot wash in a little earlier next year than this year. So that's sort of the preliminary timeline, the draft production timeline. So I'm interested in hearing and being able to convey to folks what challenges you see there, what opportunities you see, and I'm happy to share back so if that has been discussed with the National Advisory Committee, I'm happy to share back any thoughts that they had on any of the potential challenges that we might face or opportunities. So I would love to hear from you guys. When you look at this index, what do you see? What kinds of flags do you see and what kinds of opportunities?
Anna, this is basically we'll have, but the way February. They run into feedback on prelim results. I'm just giving you that as a heads up.
Thanks, Jennifer. Jeff, did you have any insights on that?
I could barely hear this, so I had to change my phone around a little bit. Could you do that again, please?
Sure, Jeff. I said that I believe budget period 1 FOA funding opportunity for the new 5-year cooperative agreement in February. But
I have heard that they're going to try and get out earlier, but like you, I don't know for sure. It would be good if we had somebody from CDC, well, maybe Harold Peets or somebody could find out for sure when they plan on doing it, but my understanding was they were pushing it for earlier than normal.
We had, that issue actually did come up in the model work group and in the NAC meeting to some extent with concerns about folks trying to write their proposals at the same time they were reviewing data. And it was discussed at the National Advisory Committee last week, and Steve Redd is on the National Advisory Committee and was there, as were some other folks. And I think the ultimate feeling, one second, the ultimate feeling expressed there, what we came away from that with was that it wasn't seen as a huge impediment, that there's actually, if anything, a potential for folks, if they want to cite any of the preliminary numbers in their proposals, that gives them that opportunity. And it also aligns with appropriations, which was seen as beneficial and sort of outweighing perhaps some of the other challenges. But I think that that concern has been heard, and it is top of mind and being discussed how we can best facilitate this opportunity for folks who are going to be working on grants or who are possibly going to be working on their proposals. But I think ultimately the group came down on the benefits of this timeline outweigh the challenges in terms of that funding piece.
I'm not saying that you will probably back. That's the plan.
Well, my biggest concern is I want us to make sure that we have the preliminary results in the field long enough that folks have an opportunity, even with some competing commitments. I don't want folks to feel like we're trying to curtail their ability to provide feedback.
Correct, because this time, if you give them at least longer to have better outcome, that's just from
Mm-hmm.
them ahead.
This is Jeff. So I have to agree with Jennifer. If you put this out or if you ask for feedback anytime around the application period, I know from listening to numerous folks that is priority, especially with the loss of funding. It's still, unless Jennifer has any information I don't have, it is still very unclear about the that funding that was taken out in order to fund the Zika response. If that funding is not returned, as had been previously stated, then a lot of the FEP folks are looking at severe consequences. They're not going to be able to run their programs unless they do some drastic actions. So if it's a matter of reviewing an index versus trying to keep people on their jobs, trying to respond to the NOA, I would suggest, by and large, the 62 jurisdictions will focus on the grant piece. And now, whether or not you want to do a very, very brief monkey survey or other type of questionnaire to the DPHP community, including the healthcare preparedness community, I would say that if you tried to do it at the same time the grant application is supposed to start, you're going to get minimal input from any staff because they're all going to be scrambling to try to look at what the requirements are going to be, how they're going to do the requirements, and how they're going to adjust their budget if that 10% or so loss is not put back into the FEP funding.
It's always a challenge in terms of the timing with that. Get as early as possible in February. You may be either ahead of the curve of that release and or people have just gotten things, and so not in the fray of all the applications and the struggles which Jeff and Jennifer outlined so clearly and nicely.
And this would, to me, and I don't know what the schedule is for the DPHP meeting, but if it is to be a priority for all of the preparedness directors and HPP folks to consider, then we may need to consider, if it's not already on the schedule, Jen, to have it brought up at some point during the DPHPs. Now, the other aspect I have to go back to is we all have bosses we report to, and ultimately that's going to be the senior deputies in most cases. If this is a high priority and you need the feedback, I would also encourage you to engage the shows and or the senior deputies and get their input, talk to them, talk to the preparedness policy committee chair, get that person's input. Without their input and without their specific direction, and Kathy, correct me if I'm wrong, I really foresee, unless it's early as she suggested, that DPHPs are going to weigh one versus the other, and they're going to go after meeting the grant requirements, trying to save jobs, and continue to perform as their commissioners, secretaries want them to. Just my opinion.
Now, the other side with that, again, you have to do it early, but if it's on people's radar screen at the high level, the commissioners and the deputies and that kind of thing, if they are reviewing it and they know that funding cuts are coming through, it's also an opportunity to look at that the point of the index often, which is, it takes funding to sustain these works, and this is the kind of thing that we need to sustain. So if there could be ways that the timing works well with that, that could be positive.
Excellent. And just, oh, sorry.
I think what you're hearing is it's not that we're not suggesting that you don't necessarily do it, but we definitely need to look at the timing a little earlier and look at engaging senior leadership to help them move the process along with the directors of public health preparedness, STEP, and HPP folks.
Absolutely. And Jennifer, I know you said that there's not really a hole in the schedule for the DPHP meeting, but if there's an opportunity for us to send a slide for Garrett or for Jim, we can certainly provide a slide or two if that would be helpful.
That was what is right now. Starting super. That's awesome. That's an excellent. I'm planning on call because we're already on a bi-monthly. I would love for you about this time to encourage people to get. It looks like you're starting to get comments and they're going to hear it from you. We're going to send. You can send us a slide and we have a card. Those are the things that
Absolutely. Thank you so much, Jennifer. We'll definitely have someone on that October 4th call. Do you know what time that will be?
3 to 4 p.m. 4, so we
3 to 4 p.m. Eastern.
Probably give you.
Okay. Excellent. Yeah, it's been a while since we've talked to that group, so I think that's absolutely excellent. We really appreciate it, Jennifer.
I'm going to send you the calendar invite.
Okay. Absolutely.
Hi, Anna. This is Melissa Marquis from Connecticut. Sorry to join in a little bit late here. From the NACHO side of things, I don't know if you guys had considered or have participated in any of their work groups in the past, but I chair their preparedness, planning, outcomes, and measurement work group, and we're actually just talking about the status of the security index. And I think at some point, when there's additional information that we can share with some of these other groups, it would be a good opportunity as well to talk to the NACHO folks from the local end. So the PPOM committee that I just mentioned would be a good opportunity, as well as there's a little bit of a larger committee called the Preparedness Policy Advisory Group, which includes representation from almost all of the states. Their goal is every single state in the U.S. to participate on that committee, as well as the chairs of all the preparedness work groups within NACCHO. So that's a little higher level advisory group that would probably be very interested in hearing some additional updates and information about the project here as well. So if you're interested and willing, I can get you some contact information on the NACCHO end for future meetings as well.
That sounds great, Melissa. Thank you. We spoke to both of those groups about in the first quarter after the transition of the index to here to sort of give an idea of some of the work that was going to be ongoing towards the release of this year's index. So I think it is absolutely appropriate and necessary to have a follow-up call to talk about, okay, this index is out. We hope you're using it, and this is what's on tap for the next one, which actually, thank you so much, Melissa, because that gives me an opportunity to segue, because I know we're running tight on time now, to segue into our production priorities. We've already talked about the call for measures quite a bit, so I don't want to spend a whole lot of time on this. We do know there are some areas where we're specifically looking for data and measures that would be good metrics to incorporate into the index. So we're going to have an open call for measures, but we're also going to focus on infrastructure, really recruiting data and measurements around infrastructure resilience, environmental monitoring, responder and occupational health and safety, and healthcare preparedness coalitions. So I tee that up to say, if you guys yourselves are aware of any data sources or measures, and I know folks like Kathy have been digging down into this for years and years, and you know how challenging it is to identify the best measures and to find, more importantly, to find the data sources that will support them, because we all have a wish list of things we'd like to be able to include, but if we don't have the data sources, they're just not there. So if you have ideas, rather than get really deep into the discussion here with just about 15 minutes left, I wanted to say if you have ideas about who we should make sure we're including in this call for measures as we disseminate the information to really tap into those areas, whether it be NIOSH groups or whomever, NEHA, others, we really would appreciate any thoughts you have on getting that call for measures into the right hands to start trying to crack some of those nuts. But I wanted to just let you know two areas into which the index is, into which the work groups and the PMO are exploring enhancing the index. One of those has arisen directly from the advocacy for this from folks from the territories, and that is finding ways of incorporating the territories into the index. That may go one of two ways. Ideally, you would be able to incorporate into the overall calculation of the index. However, data sources being what they are and data collection being what it is, it's possible that we'll have to use proxy measures for some of the index measures. It's possible that data are not available for a number of index measures. It's possible that they may be available for 4 domains but not 2. So what is very possible with the territories is almost an appendix or a sort of a parallel computation that allows a thumbnail of the territories that does not necessarily go into the overall index calculation. And that is something that the models and methods work groups are working on this year. I know it's something that some of our health officials in the territories are advocating strongly for, and we really appreciate ASTO as being the intermediary into getting those relationships built so that we can begin really working on that. The other piece is incorporating the major metropolitan areas. Primarily, I think for this year, the decision at the NAC meeting last week was to really look at directly funded cities, so New York, LA, those pieces, and DC. It's starting small, seeing how that works, and that may also be a situation where instead of looking at them in the overall index computation, they will be sort of looked at as a thumbnail or a specific lens will be placed on those that might not go into the overall index computation. I raise these issues because they obviously, how that happens is going to be driven methodologically and mathematically, what is possible with the data we have. But communicating that is going to be a really important piece so that folks understand where that's coming from, how it's put together, if it does fall into the computational model of the index, how, and if it doesn't, why not. So I'm sort of teeing that up to get the work group's sense of particular opportunities or particular or possible minefields that we might want to try to sidestep as we move forward in these two areas.
Anna, this is Kathy. One thought as we think about directly funded cities, I think territories are pretty straightforward. I definitely understand the desire to do directly funded cities, and that's got a lot of potential. We also want to make sure that the index is meant not to be a public health emergency preparedness grant or HPP grant specific thing. And the directly funded cities are unique to that particular funding cycle, if I'm hearing you right in terms of what you're talking about in terms of directly funded cities, the 4 cities. And so we just want to be careful about why do we choose those cities opposed to other cities in messaging that. And, is that wise to do, given that's not necessarily a breakdown of, all cities across the country above a certain level, or, what's the rationale nationally if you're looking at an NHSPI, an index as a national index?
Excellent,
Kathy,
thank
I'm
you.
glad you brought that up. Also, I like where you said putting the territory. They don't get as many. There may be additional gaps. Did keep it at in each.
It'd be great to be able to have that, though, to have the territories in there, to highlight those. The other question you get with the directly funded cities, of course, is you can't separate out the state from the city and the city from the state. And so whether it's done as a full component of the index, or you happen to put together a version and collect some information that you can feed back to the cities in a version that feeds back to cities, as opposed to it being a part of the national, here's all the data for everybody to go in and see, maybe a helpful thought too, to play with it in terms of just giving them back their data.
Mm-hmm. And I think that, and maybe appendix isn't the right word, but I think you know what I'm saying. It's not part of the index computation, but I think what it offers is another storytelling lens.
Mm-hmm.
So I think that if handled well, I think we can make that work. But I take your points, Kathy and Jennifer, very well, and we'll make sure to communicate those pieces. Absolutely.
The other one I know there's a lot of interest in is tribal, and of course local, but local is be an exciting one, but that's a challenge too.
Right. I think really this major metropolitan areas is sort of a dip, a toe dip into the water to see, to start thinking about that. I know that local municipalities, all the way down to all counties, has been raised by the work group, the methodology and model work group. And it's something that in discussion with the NAC, the decision last week was made, let's tackle, one piece of the elephant at a time. And And so this is sort of a toe in that, to mix my metaphors just completely, this is a toe in the elephant, no, this is a toe dipping in the water. Yeah, it's the elephant's toe dipping in the water. Thank you, Ann. We'll and see how far down that road we can go, and begin strategizing ways to address that. And it was really Melissa's point about the PPOM and PPAG groups that really I wanted to bring up, that we are starting to think about how we can incorporate municipalities, and again, these are large municipalities we're thinking about for this year, but how we can incorporate them into the index, into the story of the index, even if not into the computational model of the index. Great. As you guys, again, on any of these items, as you guys think of things that you wish you'd said, please send them to me. We're collecting all of this. This is to tee up a conversation because we've got 7 minutes left, and I want to be respectful of your time. But as I mentioned at the top of the call, it's really time to start thinking about what kinds of tools we can begin developing, whether they be guides. You know, we have a few little things like FAQs and things like that, but guides, toolboxes, maps, visualizations, different lenses through which to view the index that can really be helpful to folks wanting to use it to inform collaboration development, to think through priorities, to think through their quality improvement issues, what kinds of tools are going to be most helpful in that space. And that's something I really hope that this work group can spend some time on this year. And I know we don't have a lot for this call, but I'm going to move this up to the top of the agenda for our next call. Well, maybe second on our agenda. We'll probably want to talk about any remaining business from that October, since we'll be right on the verge of it, that October virtual meeting. But I've just dropped in here some images from some different toolkits. You know, we have our THSSR translation toolkit, which we worked with NNPHI, the National Network of Public Health Institutes, and HRIA to think about a body of research that had been developed over many years, and what tools could really be produced from that. We came up with some pieces around quality improvement, some evaluation tools, some estimators, those kinds of things. You've got folks like America's Health Rankings or County Health Rankings or TIFA, who all have different kinds of tools. In some cases, it's just, you know, in some cases it's primarily white papers, or in other cases it's maps or analyses you can run. So I think the first step, and again, these are just 4 examples that immediately came to my mind. The first step down this road is that we start thinking about, where are those examples? Where are those toolkit examples that we really need to make sure we're examining and thinking about how we can adapt and apply to the index? So, like I said, I've just teed up 4, and if you guys have thoughts now, you know, we can spend about 2 or 3 minutes just brainstorming any others that we could start looking at, and hopefully we can put together some materials and really, as a work group, sink our teeth into this over the next few months. That's not really a question, is it? So my question is, what toolkits have you seen, or have you seen toolkits, and where should we be looking for our exemplars?
Hi, it's Melissa again. Just speaking more sort of on the local and the NACCHO side. So NACCHO has great resources, best practice, or promising practices to share around a whole host of topics. So you sort of pick the category in which you're researching something. So they've got, gosh, thousands of different tools available for locals and for other individuals to go ahead and download. So I think, you know, from a communication standpoint, you know, they've got a lot of like risk communication type of information out there. I don't know specifically in terms of this particular project whether or not there's any tools available, but I'm sure, that definitely would be a resource in which we could add information to or draw information from. And I believe ASTO has some similar toolkits available, I think.
Thanks, Melissa. Jen, are you still on? Are you aware of any at ASTO that I might have left off the list in my quick and dirty? Here are the top 4 top of mind. Mm-hmm. Excellent. Thank you.
It does, this Kathy, it does seem that you could do a lot with a website in this arena, and linking directly from different domains or subdomains to key resources, whether it's the NACHO ones we just heard about or the ASTO impact, the FEP impact ones, or CIDRAP has their Promising Public Health Practices website, and that website already has their practices indexed by NHSPI domains and subdomains. So you can go directly. They've already done the work for you, and their practices have been vetted and looked at and evaluated before they put them on the site as well. So you could do some interesting linkages from particular domains and subdomains as people explore them in their own state and get ideas about ways to address those issues.
Excellent. Excellent. Thank you. Well, keep the wheels turning on this, because we're going to come back to this over and over and over again. And as you encounter tools yourself, as you're just in day-to-day work, if you encounter something that you think we need to flag, please let us know. I think we're going to be doing some work this year, maybe cataloging some of these potential tools and linking to where we have items that pre-exist, but also thinking about how we can provide guidance on index use and developing tools specific to the index as well, where there are opportunities to do that. So keep those wheels turning. We're going to come back to this, but it is 2:30. Just a couple of other business items related to last month's call on those sectoral channel and venue priorities. Many of you have emailed me back in response to that email, and I thank you. If you haven't had an opportunity yet to provide feedback on that, I would appreciate any thoughts you have. And if you can't find the email, let me know, and I'll forward it back out to you. Work group leadership. We're still a work group in search of a chair. So if you would like to self-nominate or nominate one of your colleagues, it would be greatly appreciated. Kathy did such an amazing job last year. I know no one wants to have to follow that act, is what's going on here.
No, I would encourage someone to step up and do that. It's really very doable, and I think it's healthy in a work group to rotate that leadership. So if you're feeling at all an inkling to do so, step right up. That'd be great.
And in the meantime, we'll keep the trains running here at the PMO, but I think having a voice to help lead that effort is really, really important. Wanted to let you all know that the University of Kentucky is doing away with its Adobe Connect contracts in November. So next month we will probably still be on Adobe Connect, but the following month we will be using Zoom. And as a child of the 70s, I just said that without singing the Zoom theme song, and I'm proud. It was hard. Maybe the hardest thing I've done today. So we'll be transferring to that new platform. We think it's going to be pretty plug and play and easy for folks to use. We're doing some capacity building on it ourselves right now here. Also, if you notice any of the old archived work group recordings are missing, that's because we're transitioning those over to a YouTube format so that we can, so that we don't lose them when the platform changes. We would hate to have a year and a half's worth of work group meetings that we didn't have the compatibility for folks to be able to play. So we're working on those transition pieces. So if you're looking something on the website and you can't find it, let me know, and we'll try to send you the recording or a link to it. All right. Are there any other issues before folks go? I know we're a little over time. All right. Hearing none, I want to thank everybody again for all of your time and all of your contributions. Please, just because we only meet once a month doesn't mean you shouldn't email me or give me a call if something comes up, and you can guarantee that I'll be emailing you as issues come up. So I appreciate it much, and we look forward to talking to you all in